Put this on for me, please.
But why?
Look, it's just going to help me out and get your oxygen saturation levels.
But what is that thing?
It's a pulse oximetry.
And how does it work?
Hi, my name's Dan, student physical therapist, which pretty much means I know everything about everything. Are you a patient that has lost patience trying to understand how medical devices such as pulse oximetry works? Well, sit back, relax, enjoy a nice cup of Dan knowledge, because I'm about to explain to you how that goes down. Then afterwards, as a bonus, I'm going to take your breath away and explain why we take respiratory rate. Alright, how pulse oximetry works is it's going to measure the amount of oxygen that's in our blood. So these blood cells called hemoglobin, you can refer to them as taxi drivers in our blood. And they're going to pick up their passengers, which is oxygen. And so once these passengers are picked up by the hemoglobin, they're called oxygenated hemoglobin. And these actually absorb infrared light. Now, if you have deoxygenated hemoglobin, which are your taxi drivers without passengers, they're going to absorb red light. So the pulse oximeter will measure how much infrared light and red light is absorbed. And from that, it gives you a ratio of how much oxygen is in your blood compared to how much deoxygenated hemoglobin is circulating around as well. And that will give you your percent of oxygen in your bloodstream. So here's a quick table on what you should look for a pulse oximeter reading. So the 100 to 95%, those are the normal values, and that's a good value. Those are what you want to be. 94% and below may indicate some complications, normally a mild respiratory tract, or the fact that you may be dying. So you don't want to be lower than that. There are some variations with this, of course, like I said, the mild respiration tract issues. So if you have a patient that is around 94%, you can still do activities with them, and you'd want to put the pulse oximetry on them. And if they get below around 90% oxygen saturation, you want to stop and let the patient relax, catch their breath, and let that oxygen level go up for them before continuing exercise. All right, perfect. So now we're going to take Brooke's pulse ox here. So we're going to turn the device on, we're going to make sure it's clean. We're going to put this on her fingertip. So we're going to make sure it's all the way in on her finger, and we're going to wait for it to read. So the top number will be how much oxygen is circulating in her bloodstream. The bottom number will give us her heart rate. And right now we can see that her pulse ox right now is 97%, which is good. You want that to be around 95% and higher, all the way up to 100. All right, and her heart rate is 74, which is really good. So here's a table of normal resting pulse rates that we would want to monitor for when we're taking any kind of heart rate on a patient. So here there's normal values. So since we took Brooke's heart rate and SpO2, we want to check the beats per minute are between 60 and 100, and they were. So Brooke is considered normal. So you wouldn't want to put a pulse oximeter on someone who has fingernail polish on and may interpret or misinterpret the readings. You can also put it on their toes as well as their ears, and there's even some that can go on their nose. All right, now I'm going to explain to you how exactly a pulse ox picks up heart rate. So as your heart contracts and beats, it's going to push blood out throughout your body, and it's going to pick up all the oxygen increases. So the way I see it is like a wave. So every time there's a wave coming with each heart contraction, the pulse ox is going to pick this up and measure between each beat. And that's how it measures your heart rate. Take Brooke's respiratory rate. So what we're going to do is have the patient lie down. We're going to have one arm crossed over her chest, and we're going to pretend to take her pulse via her radial artery. This is going to allow the patient to be at ease and not think about their breathing, so they won't change the respiratory rate consciously. And so what we're going to do is we're going to watch for 30 seconds, Brooke's chest rise and fall. We're going to check the rate, rhythm, and quality. So we want to make sure that it's not too fast and not too slow. Generally, you want it in between 12 and 20 respirations per minute. And you want to make sure that it's deep and equal throughout her chest. So here's a quick table describing how the different breathing patterns are. So you have eupnea, which is normal breathing. That's around 12 to 20 breaths per minute, and that's with equal rate and depth. You have bradypnea, which is slow respirations, which is less than 10 breaths per minute. You have tachypnea, which is rapid or fast breathing, which is greater than 24 breaths per minute. This is actually a typo here in the textbook. There should be a greater sign, not a less than sign.